really agree with this statement, and I hope that the committee will do a good work to help the county government think it through. But even as we do that, Mr. Speaker, I would want to emphasize that one of the biggest challenges that these big counties face, like Mombasa and Nairobi, is that they don't only serve their own native or indigenous populations. They tend to support a number of big populations from outside those counties. If you think about Mombasa, it's serving Kwale, it's serving Kilifi, it's serving Taita Taveta in terms of people who live in those areas, Mr. Speaker. And therefore, one thing that we must fight for is that the BPS right now is going to read to this House a 4.6 trillion budget. I would want us to see that we fight for more money to come to the devolved healthcare, because about 50 billion that counties get, even if they were to divide, they can barely just invest about 1 billion in healthcare. But then the national government still remains a lot of money when it comes to healthcare, only to deal with issues of policy and to deal with the 5 national referral hospitals. And this is something we must critically look at and make sure we allow counties to get more money. And I also want to inform my brother Chirargei that actually Kisii County is not doing bad, at least on this area. That I can tell you comfortably, that Kisii County has got a lot of challenges in terms of healthcare, in terms of placement of the little they get, because what we need, Mr. Speaker, I haven't even finished saying my point.
Mr. Speaker, I think it's he's making false allegations. Sanitize things in this house. Mr. Speaker, I would like, on a point of order, mention that I find it completely unacceptable that my colleague Eddie, that I respect and have a humble respect for, who, even when we went to Migori and we were asking to be taken to Ombo Hospital to see what services are there, we were not allowed by his governor. So I don't know when Senator Eddie ever went to Kisii Hospital, levels 5, and inspected the facility, confirmed that everything is working, other than the fact that he's sanitizing my governor on this floor. I find that completely objectionable.
Chair, first of all, I want to request that I had 1 minute. So, thank you, Chair. So, Chair, I think it's unfair for the Senator of Kisii to attack my statement in anticipation. I haven't even said what I wanted to say. If he has got personal beef with his governor, that is his personal beef with his governor. But I was saying that comparative to what I see in Migori County, a number of these counties that are close to other counties, I have said Kilifi depends on Mombasa for healthcare services, so is Taita Taveta. It's also true that Migori County heavily depends on a number of hospitals in Kisii. I have had my own parents and even my own family members go to Tabaka in Kisii for medication, go for referral services in Kisii, because they have got better facilities than Migori County, and that's a fact. That's not a lie. So I think it's out of order for the Senator of Kisii to say that I'm sanitizing Kisii when I just give my experience, and even the people of Migori will tell you that for more of better referral services, we get them in Kisii and Bomet, a place called Tenwek Hospital. This is a Tenwek Hospital. That's where most of our people go and get medication. because Migori is struggling in these services. So I've said, and I can categorically say that Kisii County has got better facilities than us, Migori County, and my governor must work harder to be able to reach the levels of Kisii and the levels of Nairobi. And then lastly, Chair, on the issue of medical equipment, very fast in 2 seconds. I think